well. Welcome to our event today. You didn't get slipped away in the snow. That's good. I want to welcome you today because this program is an important one, and we're glad to see that some people who are very interested in this topic are here today, and some others who want to share that information with more people. We also want to let you know that this is being videotaped by CLTV, which is the cable access channel in the Chisago Lakes area. And it will be rebroadcast on CLTV with links from our web pages and other web pages so that it can be watched and viewed by your friends and neighbors if they missed the program and they might be interested. I don't want to take a lot of your time because our speaker has a lot to say, but at first we want to welcome for our event today, we have someone who is sponsoring our lunch today. And I would like to invite you to meet Mariette Hafler, and she's going to tell you about her organization. Briefly.
It's tiny. Hi, welcome. I'm so glad you took the time to come here today. This is a wonderful, wonderful topic, much needed. I'm with Hospice of the Midwest. As Lonnie said, my name is Mariette. I was Knighton and married to Hafler. So I've lived in this area almost 50 years. So I only went away for college. And I just want you all to know something I'm very passionate about. And that is earlier hospice. Okay? Hospice doesn't need to come on right at the very end of life. It is a benefit that you have paid in for most of your life. It's a Medicare benefit. It provides nursing that comes to the house. It provides home health aides. It's free. It pays for all durable medical equipment, walkers, wheelchairs, hospital beds. It gives you many other auxiliary services. It depends on the hospice, and you do have a choice of hospice. That is another thing people do not know. There are different hospices out there. And I want to encourage you to get information about hospice. Do an informational. I'm happy to come out and meet anyone and do an informational on hospice before it's a crisis. If you bring on hospice as soon as someone is eligible versus when they absolutely need it, there's a huge difference, and that's called living with the benefit. Okay, when hospice comes on and nurses are coming to see you weekly, manage your symptoms, manage your medications, preventing you from having to go out to the doctor if there's any sign of any infection or fall. We have portable x-rays. It really saves a lot on the patient. As you know, when you go into the hospital, a lot of times someone declines more. So if we can be coming to the patient, it really helps them actually live longer. And earlier benefit, you get to have things like your legacy letters written from one of our volunteers. You get to do things you enjoy still. We want to support you in doing the things you enjoy. Getting ready for a special event, traveling up north. Just living with the benefit. Sometimes the psychosocial that hospice brings with all the visitors, volunteers, pet therapy, massage therapy, music therapy, that improves people's lives alone, the psychosocial, let alone symptoms and pain being managed on top of medications being managed better, maybe narrowed down. People sometimes get so good on hospice that we have to graduate them. Because if we can't prove a decline, Medicare won't pay for it anymore. Okay? And it can just be subtle declines, and of course we try very hard to show that because people always say, I wish I would have known about this sooner. People never say, I wish I would have waited. Okay, so sometimes we have people on 6 months, year, 2 years. We've had people on 3 years. We just keep requalifying them. So, any questions, I'll be here. I have some handouts up here. We have an office in Forest Lake, just so you know. So nursing and the team is all local. Okay. I'll be here. There's handouts, brochures, little things like this card on a hospice app. It's called Hospice at Your Side. You can go in there and there's all sorts of information on hospice, education, flashcards, videos. There's a whole library of music for music therapy for someone. There's also a list of diagnoses and what are qualifiers. What do you want to look for under heart disease if someone might qualify? And evaluations are always free. There's never any cost. Okay? Thanks, Lonnie. And I am on the board of Age-Well too, so I'm so happy to see you all here.
I should have mentioned that she is on our board of directors, which is out of the way as well. At this time, I'd like to introduce your speaker for today, and we are very delighted to be able to have Colette Colucci, and she is with Family Pathways. She is a diabetes. She is a dementia educator with Family Pathways. I know as you arrived, some of you had questions, and I'm sure at the end of her presentation, she would welcome your questions. And so please, and I want to remind you all that there is an evaluation form that was placed on your table when you sat down from Chisago Age-Well, and we would very much like you to complete that evaluation form before you leave today, and you can just leave it on the table when you leave, and we'll collect them. We use everything you tell us on there for future events. We appreciate your input. And I give you Colette Colucci.
Thank you. Thank you. I'm not going to use a big microphone, but can you hear me? Yep. I have a pretty loud voice. I've been working with seniors for over 30 years, probably 35 now, I'm getting older. And I worked in a dementia unit, so I was hands-on with residents that had dementia. I've been doing education on dementia for probably 10 years now, specifically for caregivers. So my education that I do is specifically for the caregivers, because you are a very unique group. You're courageous, you're strong, very unique, and a lot of you are dealing with a lot of stress, especially if you're caring for someone that has dementia. How many of you have someone that you're caring for that has dementia? Okay. How many of you know someone that has dementia? Yeah. Pretty much all of us do know someone that has dementia, is living with dementia. Or yourself. How many of you have dementia? And it's okay. You don't have to. Yeah, that's right. So today we're gonna talk about the diagnosis of dementia. First of all, and in your folder there is a PowerPoint if you want to follow along. I'm one that doodles and likes to write things, so there's pens available, and if you want to write down certain things, because we will be doing some activities as we go about this class. So it really is your participation also in this class. So I want to welcome you. I'm glad you made it through the snow. I can't believe we got winter now. Who knows how long it's going to last, but I like to see the snow. So I was happy to see that snow this morning. Not too happy to drive in it, but happy to see the snow. So I want to go around and quickly, if you would just say your name and if you're caring for someone that has dementia or why you came today. Can you start over here?
I'm Pat Walker, and I just came for information.
Thank you.
MJ Saviano and I too are here for just information. Lorraine Swenson, just for information. Mary Lou Burton, my husband has dementia.
Tony Chalstrom, my father has dementia.
Jackie Hilliard, and I just came for information.
Nancy Bunny and my husband has dementia.
Paul Robinson, I'm here to learn how to get dementia.
Oh. Well, that's the first.
Barb Robinson, information.
Okay.
Kirsten Thompson, my mom has got Alzheimer's.
Okay.
Cindy Wyrock, my sisters have dementia.
Doug Jurek, I'm caring for someone with Alzheimer's.
Sharon Clark, my parents both have it.
Okay.
Scott Vlasic, information.
Lisa, information as well.
Jim Langlers, more information.
My husband had brain surgery after a fall, He's lost his short-term, long-term memory. So that's kind of where we're at.
Yes.
I'm here, my husband has dementia.
My name is Barb, and I believe my husband's just starting, so I'm getting more information.
Okay.
Nova Gustafson, I'm here for information.
Larry Marek, my sister has dementia.
Marilyn, and I'm here to learn the signs of dementia and distinguish it from old age.
Yeah.
Mary Murphy, and my mother-in-law has dementia.
Okay.
Debbie Slavic, and I'm the care director at Lakeview Church, so good information.
Yes.
Pam, I think information.
Yeah, I did information also.
Sue Huber, information.
Rochelle, I'm here for information.
Michelle for information.
Kevin, for information.
Ernest Knudsen, caregiver.
Okay.
Monty Meeker, here for information.
Kay, here for information.
All right, so I'm glad to see some of you are here for information, to find out if there's somebody that you might be living with that has showing signs, or just getting ahead of yourself to find out, what is this? What do I have to look at? What do I have to plan for? So great, thank you all for sharing. So our objectives today are to discuss what dementia is, learn the most common types of dementia, learn the warning signs of dementia, identify community resources, help navigate through the diagnosis and life ahead. Okay? So what is dementia? Anybody? What's dementia? That's why you're here, isn't it? Confusion. So dementia is not the disease. Dementia is not the disease. It is the overall term that describes a range of symptoms associated with decline in memory and other thinking skills that are severe enough to reduce a person's ability to perform those everyday activities. So dementia is not the disease. Alzheimer's is the disease. Parkinson's is the disease. You can get dementia from those diseases, okay? And the most common type of dementia is Alzheimer's disease. And you can look at the umbrella that we have there that has dementia at the top there. It'll show Alzheimer's is 60 to 80%. Also Lewy body dementia, if you've heard of that, that's 5 to 10%. Vascular dementia, about 5 to 10%. Frontotemporal is very, very less. And then the other dementias from Parkinson's or Huntington's disease. So Alzheimer's is the most common. Vascular dementia is the second most common, and that's usually followed by a stroke. That has to do with the blood flow. Okay? Dementia with Lewy bodies is the third most common cause of dementia. And Lewy bodies is the cortex part of the brain. And some of that, the symptoms there are falling or hallucinations. And that's caused by protein buildup in the brain, okay? It also, it causes problems with the way your brain works, affects the memory, movement, and the skills, the motor skills. And a lot of times it mimics Parkinson's. Frontotemporal dementia is the least common, and that's the front cortex of the brain. And that has to do with language problems. And that's most common with people that have early onset. Early onset is when you get a diagnosis when you're in your 40s, 50s. So dementia, is dementia a challenging disease? Is it challenging to take care of someone that has dementia?
Oh, yeah.
Oh, yeah. What's one thing you can think of that's most challenging? What was that?
They have trouble talking and communicating.
Right.
And sleeping is another problem.
Yeah, communication is one of the major things. Anybody else that's caring for someone that has dementia? What is the most challenging problem?
Aggressive behavior.
Aggressive behavior, some of them can be aggressive, not all of them. Some of them can be. Memory. How about repeating? Repeating over and over again. You have to have a lot of patience. You know, and communication is a challenge. Because sometimes they just can't get the word out.
I was gonna say that.
We're gonna talk about what's called compassionate communication with someone with dementia. And give you some tips and ideas on how to use some compassionate communication. So when your loved one or yourself was diagnosed with Alzheimer's or dementia, what are some feelings that you had, first off? What are some feelings you had?
Anxiety.
Anxiety. Denial. Denial, a big one. What else?
Sad.
Sad, yep. Sad,
Questioning why it happened.
yes. Questioning, why did it happen? What did I do wrong? Why me? What do I do now? You know, what is life gonna look like now in the future? So diagnosis is that one first step on your journey living with dementia. A lot of caregivers that I work with, their loved one hasn't even been diagnosed, and they're working with someone that the doctor maybe doesn't want to diagnose them. She knows there's something going on, the family members are in denial, and she feels by herself. How many of you feel like that? Or felt like that? Yeah. I mean, it's not something you're gonna announce at Christmas. You know, it's not something you're gonna let everybody know, oh, you're excited about, I got dementia, or I was diagnosed, or my loved one was, okay? There's a big stigma behind it, a big stigma behind it. But I'm here to tell you that there's some people that have dementia that live really joyful lives. That have fun and still do things that they like to do. And being diagnosed is one thing that says, okay, I'm gonna get my affairs in order and I'm gonna do some things that I like to do. That's one good reason to get diagnosed. Also, maybe get some treatment. Maybe get on some medication. Doesn't take it away, it might slow it down or might help with those symptoms that we talked about. Okay? But definitely some frustration and fears. So how can you live with dementia? Try thinking of dementia as a disability, like you would if you had a disability. If you weren't able to walk as well, if you weren't able to see as well, you weren't able to hear. Be aware of each person's ability and be honest about where you might need support with help. And continue to do things that you have always loved to do. This is really hard for caregivers to ask for help. When they come to me, they're already in that really frustrated, stressful situation. I would love to see them come to me a little bit earlier so that I could get them so they don't get to that point. But a lot of times they're coming to me as a caregiver consultant, and that's what I do, I consult caregivers. And they're coming to me and they're saying, oh my gosh, I am so stressed, I can't even handle it. My loved one, you know, he's up all night long. He tries to go out the door. You know, he's yelling at me and I can't communicate with him. I've had it. You know, and that's where I have to try to get him down a little bit first. Say, okay, let's talk about what is your most challenging thing. What's the first one thing that's most challenging, and work at that first. And try to get their stress level down. Because what happens if your stress level and you don't take care of yourself as a caregiver? What happens? Anybody, what happens? If you're a stressed out caregiver, you can't get, who's the one that ends up in the hospital? Yeah. And what happens to your loved one then? Yeah, so planning is really important and self-care is really important. I really talk a lot about self-care with the person living with dementia and the person that's caring for someone with dementia. And self-care is not selfish. Self-care is needed. Everybody needs self-care. And everybody's self-care is different. The diagnosis is not your fault. It's not something you caused. It's not something that, oh, I did this to get it. With a positive approach, you can live a good life and meaningful purpose and value with dementia. So here's where we're gonna do a little activity. On your sheet, it says fact or myth about dementia. I want you to put down if that like 1 through 5, if that statement or that question is a fact or a myth. I want you to do that right now, and then we're gonna go back to it when you're done, okay? So fact or myth? Everybody know where we're at?
Yeah.
Okay.
Okay.
That wasn't too hard, was it?
No.
Okay. It's probably the hardest thing you have to do. All right. Number 1, memory loss is a normal part of aging.
True.
Myth. How many put fact? Ah. No. Wow,
See, that
that's
was a
awesome
myth.
that I can teach you that memory loss is not a normal part of aging. The memory loss that we're talking about with dementia is that affects your daily life is not a normal part of aging. It's because you're getting old doesn't mean you're gonna have that bad memory loss. Yes, you might forget people's names sometimes or important dates, but those things you'll recall at some point. Person with dementia, they don't recall that at all. A difference is if you have your car keys and you forget where you put them, the person with dementia doesn't know what they do. Okay? So that's kind of a little scenario that say, okay, you can give them the car keys, but they're looking at it going, I know these are good for something, I'm supposed to do something with them, but not sure what I'm supposed to do with them. But how many of you have lost your keys? And you put it in a weird spot or something. You find them sometime, you know, that's just normal stress because you've been running around doing stuff and not paying attention. But no, it is not a normal part of aging. Alzheimer's disease is the most common type of dementia. That, yes. Number 3, my family member has memory loss, so I will have it too. Well, there's a 20% chance that you will have memory loss if your family member has had it. And they have said that Alzheimer's disease is hereditary. So some of you are going, oh, correct. I wouldn't have known that. But, you know, I have some caregivers and some family members that are already planning because they are thinking that they will have dementia. That they will get it because their parents have or their relatives have. So, 20%.
Thanks, Mom.
Or there's nothing I can do to help family members with memory loss.
Myth.
Is that a myth?
Yes.
Yeah. Being understanding, doing the research, how to communicate with loved ones, coming here to this class. Those are all things you can do to help the person with memory loss. Number 5, if I keep repeating myself, someone diagnosed with dementia will get it and remember.
No.
Amen. But you know, family members do that. Caregivers will do that. But if I keep saying it, they'll remember. No, they won't. They lost that ability to remember. So if you try to get them to remember, oh, Sally, remember Sam? She's gonna go, I don't remember Sam. Yep.
My brother was diagnosed with vascular dementia last spring, and his family, his 2 sons and his sons' friends, and he went moose hunting in Canada it was either September, October, and then his one son just made him a book of all the pictures that they took and did some captions and stuff. Will that help him to remember that journey?
Could.
As he
A memory
ages?
book is great. You know what he's gonna remember? He's gonna remember the good time he had on that trip. He might not remember who he was with,
Okay.
and we might not remember the names, but he's gonna remember the good times. And that's, who doesn't wanna remember good times? That's gonna make him feel good. If he's having an agitated day, that's the time to bring that book out and go through it. And don't say, do you remember going? Just go through it. You know, say, you know, point out some different things in the pictures. But yeah, he would remember the feelings. Because those feelings are back here, and that's the last thing to go. They remember those feelings. Might not remember the name of the person that they're visiting with, but they're gonna remember the good feelings they had when they had that visit. Yeah.
I have a question as far as family members, so what does that mean? Like, my mom and dad, or like I have an aunt who's got dementia, so anybody within the family?
As far as I know, I don't think they've been that specific on knowing that I know of. I don't know if anybody else knows, but I don't think they've been that specific on what family member, but they have said it's hereditary. I think it's more so your parents. So,
More so your parents than your siblings?
then what?
More so your parents than your siblings?
I believe so. That's what I've heard mostly. You know, I don't know, I mean, that's research that you can look up and see. You know, there's changing things all the time. Different research and things that they're coming out with. Okay, very good. All right, you get a good mark for that one. I don't know if I'll give you an A+, but I'll give you an A. All right, we're gonna go through the 10 warning signs, and this is where a lot of people have said, what are the warning signs of dementia or Alzheimer's? The first one, memory changes that disrupts your daily life. We talked about that, where you don't remember important dates or events, okay? Number 2, challenges in planning or solving problems. This is where you can't concentrate and be able to balance a checkbook or follow a recipe. If this is something you've always done and all of a sudden they're having problems doing that, what happens when they try to follow a recipe, they might get the first 3 ingredients, forget to go on and go back up to the first one again. Okay. Number 3, difficult but familiar tasks. That's like driving and rules to a game. Daily tasks. Bathing is one thing. You'll notice that they don't bathe as much as they used to. Either they forget or they just don't want to get wet. They don't like that feeling of getting in the water. It's cold, it's, you know, that's probably one of the number 1 problems a caregiver has is to bathe their loved one. They just don't want to do that anymore. For one thing, if they're very, very shy about, you know, of getting into the bathroom or the shower with someone, a son or a daughter especially, they don't want them bathing them, you know, so bathing is a hard thing. 4, confusion with time and place. This is where they might think the middle of the night is early in the morning. Places, they get used to their small little area in the house. Sometimes they don't even go to church anymore because that's disruptive to them. there's too much noise, too much going on. Their space becomes smaller. Okay? Number 5, they have trouble understanding visual images. They can't judge distance. Have you ever seen someone walk like this? Especially over a black rug. How many businesses have black rugs? A lot of them. So a person with dementia, they might walk in there and not want to go any farther because they think that black rug is a hole. And they might walk around it. Or they might try walking over it. Or they might not go in at all. So if they're resistant to do something, they're seeing something that you're not seeing. So you kind of got to get in their head and try to figure out what's going on there. What's causing them to be resistant, not wanting to go or not wanting to go with you. It's not because they're trying to be difficult, it's because there's something going on that they don't like. There's something that they don't feel comfortable with. My one caregiver says, my husband's just difficult, that's just the way it is. He said, he's not trying to be difficult, you know, because it is the disease doing that. Was he like that before? No. Well, they also are trying to figure out why their brain isn't working right. You know, if something's wrong in your body, you have a hard, some of us get mad, cranky when you get tired or ill. Think about having that every day, of not knowing what's going on. All right, 6, trouble following conversation. They repeat. Word finding, they can't name the object or they call it something else. They might call a watch a hand clock. They find new words for things because they can't remember that word. So they'll just make up new words. So a lot of caregivers, especially if they're there with them every day, are gonna know these different words and they're gonna know what they're saying, but someone outside is gonna say, what? What are they saying? You know, so they will find new words. They accuse of stealing. Number 7, they have misplacing things and losing the ability to retrace steps, like I was telling you. They accuse people of stealing. I have a caregiver that his wife, every day they kind of go through this trying to find her purse, that she puts it somewhere and then they can't find it. And she accuses him of taking her purse, and he's like, why would I take your purse? I don't need your purse. Well, you're gonna take my money. You're taking my money. You know, well, he figured out this is happening all a lot. Let's go find your purse. Come on, let's just go find your purse. I'll help you find it. So we walk around and try to find the purse. One day he found it in the freezer. And he just, you know, instead of getting mad and saying, why did you put it in the freezer? He said, well, honey, I think you wanted cold cash. You know, it made her laugh. He picked the purse out there and everything was okay. So really you have to make a little funnies or you have to be in their world. You can't get upset. You know, you can't, you know, it just doesn't do any good to argue with them. You have to live in their world. If you've heard that before, it's true. You have to live in their world. 8, decreased or poor judgment. So how many of you heard of people giving away money? Well, because they have poor judgment. They're giving away money. Or their dressing and grooming has declined. They just don't get themselves made up anymore. Also, then we're looking at 9, which is withdrawal from work or social activities. They're not interested in hobbies anymore. Maybe they're a big churchgoer and they just aren't going anymore. They have a hard time being social. They have a hard time being in a group. Why do you think that is?
Because they are under stress, they want to hide the fact that they can't remember things or do things, and so it's stressful when you're out with people. But if you just hide in your room, you can be yourself and
Right.
not
Yeah.
worry.
It's stressful, it's hard on you, makes them very tired, makes them very afraid. Do you want to go somewhere where you're afraid? So that's a lot of times the family's first, warning that their loved one there's something going on, that all of a sudden they're not going to church. Or their neighbor is saying, I haven't seen them come out of the house. Or friends say they don't come and play cards anymore, they don't come out to the senior center, they don't come out for lunch, what's going on? And that's where you need to help them out. Maybe you need to visit with them. Go to where they are. Don't expect them to come if they're not comfortable. Oh, we missed you at the senior center for lunch. Why don't you just come? I'll come with you. Oh, I just, How about if I bring lunch to you? We have it at your place. Oh, that sounds great. So go to them. They don't need people to go away from them. They need people to come to them. Okay. 10, changes in mood and personality. This is where sometimes they get confused, suspicious, depressed, anxious, angry. But you can kind of see why that happens. Their mood gets upset really quick. They can change real quick. Sometimes that happens. Or sometimes they just become within themselves. And they're not as social as they used to be. The 10 warning signs are not real uplifting, but it's realistic. It's just knowing what's going on and what's happening. So what happens after the diagnosis? It's a life-changing, terminal, stressful time. What happens after the diagnosis? And this is what I talk to caregivers about really getting out those feelings about being diagnosed, living with someone that's being diagnosed. Also, let's make some plans. Okay, what do we do now? After you come to the point where you have that reaction happen, and then you're going to be dealing with those emotions through the whole journey. But really, giving yourself time to digest what's going on, what's happening, coming to classes, looking stuff up, getting some education is key if you are living with someone that has dementia or you have dementia yourself. And getting your affairs in order. So if your doctor hasn't diagnosed you, but you're concerned, go in and get a memory screening test. And don't be afraid to be your own advocate. Right now, more than ever, you need to be your own advocate on your own health. And don't take things lightly. Don't say, if they say, oh, don't worry about it, you're fine, but you really don't think you're fine, then go back or go to another doctor.
I just had one of those preliminary memory screenings and didn't do real well. But what is the next test? The next step? You go to your doctor, are they going to give you like another?
Go get a referral for a neurologist.
Yeah, I have that.
Okay, did you go to the neurologist?
Not yet, no, I have an appointment.
Go to the neurologist appointment, and usually a neurology appointment did they say it was going to be a pretty lengthy appointment?
No, they didn't say anything, but I would assume that they would give me another test, maybe more.
Yes, it's going to be a 3-hour testing, yeah. Okay. It could be. I mean, unless you're going for just the consultation, but then you have the 3-hour testing. And they can really kind of figure out where you're at. Okay. If you have a very good neurologist, you'll get, they'll be very good at letting you know what you can, what it looks like and what's going on.
What kind of medications would they put you on?
I have no idea really what they have decided to put people on anymore. Does anybody know the new stuff? Yeah. There's always new stuff coming out, and it kind of depends on your own body, your own self, of what you can handle. So that's really a question for the doctors. Yeah, but neurologist is definitely, and get it. If it's someone that you're not happy with, go somewhere else. Just because they say some things and that's a bad experience for you. I've heard people having pretty bad experiences from some neurologists. Then go somewhere else. get another referral from someone else. So the best advice for you after a diagnosis is to be gentle with yourself and those around you. As I said, to help you process the diagnosis, learn about the disease. Communication and patience is important. Talk with the family, be honest. Don't try to hide it. Let your family members know, let your kids know. And let your kids know, or your family members know, that you're gonna need help. After the diagnosis and you're a caregiver, you're thinking, you know, I got this, I can do this. Yeah, but when it progresses, you're gonna need help. So get your circle of support right away, okay? Okay, work on a care plan, work on something that you know, a plan of care, which is, you know, you're getting your support team. Someone that can maybe do the finances, someone that can help you with medical appointments. Get a list of questions for your doctor. How many of you go to your doctor with a list of questions? Okay, not a lot. Gotta do that. Because once you get in the doctor's office, you know how fast they talk and how you know you gotta get out the door. I bring a list and she's always like, okay, let's go through your list. You know? And you put the most important ones at the top, just in case you don't get to the end ones. But really, make a list when you have your doctor appointments. Seek support from a caregiver consultant to help navigate important resources. And this is where the Age Well Coalition, what we're doing is we have a bunch of resources. I have a resource table here, a bunch of resources for you. Don't feel that there's no one out there that can help you. If I don't have the answer, I hopefully can get someone that does, okay? We have support groups, we have memory cafes, we have, you know, classes, we've got, you know, the caregiver consulting is what I do. That's meeting one-on-one with you at a coffee shop, at your house, the library, anywhere. Just for you to say, you know, this is what I'm dealing with. Sometimes I'm just listening. Sometimes it's just that you need someone to listen to. Or so, go ahead.
I think it's helpful when you visit your doctor to bring your spouse, one of your kids, somebody else to listen to what he's saying.
Yeah.
I always
Yep.
do that.
To have someone else there so that you
You
can listen.
don't always pay attention.
Yeah. Yep. Yep, very good.
Or you might have what they call it, white coat syndrome.
Oh, white coat syndrome?
Blood pressure goes up.
Yep. Yeah. Yeah. Yeah, you wonder why your blood pressure goes up when you go to the doctor. It's always good every other day, but you didn't go to the doctor, your blood pressure goes up. Yeah. Yeah, and have someone there that can also listen to what is going on, especially if you have concerns. Don't hesitate to ask for help. Find the best in every moment. There are still memories to be made. There's still life beyond dementia, living with dementia. Enjoy and savor all those moments. So here's some more tips on what to do next. Educate yourself, we talked about that. Choose your team. Appoint members to your medical team. We're talking about your physician, your neurologist, counselors, professional people or not professional people, your family members. Have a support system. What I have my caregivers do a lot of times is I'll have them write down people that they trust that they know would help them, and then write down the second column of the things that you need help with and match them up. Try doing that. Can't do this journey alone. And a lot of people think that they have to and you don't have to. If you don't have family, you don't have friends, then look at church members, look at, you know, organizations that have volunteers. You know, so just remember you don't have to do this by yourself. Take stock of your finances. You want to look at what's going on with your finances. Know what your health insurance pays for and what they don't. Know your options, your end-of-life wishes. We talked about hospice. Your healthcare directive. Where are the Memory cafes, where are the support groups? What's the memory care units like? Visit some memory care units, even if you don't think that's an option, but you never know. You never know when life throws something at you. So know those memory care units that are in your area. Maybe you need an individual counseling, talking out your feelings can really help. Socialize, continue to get together with your family and friends, and maybe they can come to you. Maybe they can come to your house. And keep up with interests and hobbies that you still can do. Or adapt so that you can do them. Okay? Advanced care planning, the healthcare power of attorney again, living will. What are your plans? What do you want done if you can't make those decisions yourself, or your loved one can't make those decisions? Don't wait until that person cannot make a decision, that they're not able to make that decision. So do it before they get to the point where they don't understand and cannot make decisions. We're going to look at compassion communication is what I talked about. How to be compassionate with communication. And I have a sheet up there on the table that talks about it. Okay? There's also some examples. I love this in the back. There's some examples of what compassionate communication is. Okay? So the first thing is, you can't control memory loss, only your reaction to it. How you react is big. And I'm going to tell you some don'ts and some do's, okay? Don't reason. Don't argue. Don't confront. Don't remind them that they forget. Don't question about recent memory. Do you remember? Do you remember? I told you that yesterday. Don't take it personally. Don't think they're doing it just to make you mad or to upset you. Don't take it personally. What can you do? You know, the do list is bigger than the don't. That's nice. Do give short one-sentence explanations. Allow plenty of time for comprehension and then triple it. Repeat your instructions or sentences exactly the same way. Eliminate but from your vocabulary. Substitute it for nevertheless. Nevertheless instead of but. Avoid insistence. Try again later. If they're not having a good day, try another day. If they just won't shower today, and you're like, oh, it's been 3 days, you really need to shower. We gotta get you in the shower. You need to shower. If they're resistant and fighting back, you're not gonna get them to shower. Just forget it and go on the next day. Agree and redirect to different subjects or activities. Accept the blame when something wrong happens, regardless of the cause. Accept the blame. That's my fault. I'm sorry. Join the person in their reality. Anybody know what that means? Join your person in their reality.
Instead of trying to convince them of what reality really is, meet them where they are.
Yep. They could be back when they were a kid. They could be when they were growing up. Could be when they were having children and they're looking for their child. They're looking for their baby. So getting into their reality. What's that baby's name? What's that baby look like? The baby's fine, the baby's napping. And that's really hard for some people because you're like, but I'm lying. But it's not really lying. It's just those things you have to do to get through that situation that you're dealing with. A lot of times it's, I want to go home. How many of you have heard that? I want to go home. What's home like? What was home like? What did you like about home? Get the subject on going home and talking about home as something else and redirect to something else. Because that's a big one, I wanna go home, a lot of times. Sometimes they're home, you are home, you know, but you can't say that because then they're gonna get mad. What do you mean, I'm not home? I don't live here. Yeah. Leave the room if necessary to avoid confrontations. I know a caregiver that just, sometimes he just has it and she just continues to go at him. And he'll say, I'm leaving the room. Be gone, come back 10, 15 minutes later, she forgot what they were arguing about. So, respond to the feelings rather than the words. How are they feeling when they're saying those words? Be patient, cheerful, and reassuring. Go with the flow. Practice 100% forgiveness. Memory loss progresses daily. And it's hard to always be forgiving. It's hard to always be generous and gracious. But these are the times where you need to practice that. And one of the things I want to let you know is when you're communicating with someone, it takes a person with dementia 20 seconds for them to respond to a question. Do you know how long 20 seconds is? It's a long time. And when you're asking them something or you're going somewhere, instead of saying, do you need your hat? Because that's a question. Say, here is your hat. Okay, do you see the difference? Do you need your hat? They're gonna think, do I need my hat? Is it cold out? I don't know. But if you say, here's your hat, they'll say, oh, thanks. Okay, so it's all in the way that you word things. And in this sheet, it'll talk about the do's and don'ts and how to get through some situations. I really like this sheet. So, pick one of those up. That of my caregivers really, this is a go-to for them. There's also a sheet that says understanding the different types of dementia, which is really nice. You got the different types right here, and then you got the mild, moderate, and severe. This is really a great handout too that's up there. Talks about treatment and diagnosis as well, types of diagnosis. So, the next thing is talking about self-care. Self-care, it's written out, self, S, simplify, E, eat well, L, let go, and F, feel your feelings, that's self. The care part is C for celebrate, A, ask for help, R, rest, and E, exercise. These are some good words of self-care to live by if you're a caregiver. So, self-care is not about adding unrealistic amounts of time to your day, but it's really about how to do self-care practices daily. And self-care could be walking your dog, it could be taking a nap, it could be exercising, it could be reading a book, something that you like to do that you don't give yourself permission to do. So I'm giving you permission to do that, okay? Or breathing, deep breathing, or meditation, or anything like that. Some things that you like to do or have done. If you don't know what to do or you don't have any idea, email me, I'll give you a list of them, of some things to try, okay, for some self-care. So the next part is continue to laugh and enjoy the person that you're with. It's okay to be goofy and fun, as you can see from those ladies at that picture. It's okay to have fun, it's okay to be goofy. You need to laugh. You need to make funnies, like the gentleman that found the purse in the freezer. You need to laugh. You need to have some fun. And enjoy life. Make sure your hobbies. As you can see here, there's a lady that is painting and her other arm is in a sling. So we were helping them adapt to do their hobby that they like. So think about adapting their hobbies for the person that maybe they can't do that piece, but maybe you can adapt it so they can still do a favorite hobby. Because what do you feel like when you do something you love to do? Your hobbies or your activities. How does that make you feel?
Good.
Good.
Your own self.
Yeah, makes you feel like you're doing something for your own self, for you. And that's somebody that has dementia, that's what they are going to feel. They need to have a purpose as well. They need to have a purpose in life too. So trying to find something that they like to do and enjoy can give them purpose. There's some resources in the back there for you. Our email at Family Pathways, you should have a card of mine, a card of here of mine. Also, what I do is the one-on-one consulting. And I also do one-on-one classes. If you know someone that couldn't come to class or is interested in a class, I do those one-on-one, the one-on-one consulting. This is in your folder. So my information's at the bottom. So, any questions? Yes?
So, what if you have someone that doesn't want to get tested, they're showing symptoms, but they don't want to know because you're afraid? So some of these things that you were saying about don't argue or don't remind them, how do you do that differently with someone who just doesn't want to try to get help? They're just in denial.
So do they talk about it at all?
Slightly,
Okay.
yeah, but then they just say, I'm fine.
Yeah, that's very typical, very typical. I mean, you can bring up the subject and you could possibly give them information on it, but if they get agitated or they get upset, let it go. Let it go. Sometimes you can go through, caregivers go through the whole journey and their loved one's never diagnosed. I mean, you can't force them. It's not healthy for them either to be forced to get a diagnosis because they just won't, they're not gonna go. So, I mean, just you getting the information, you getting the education on what to do would help, definitely. But, and just letting them know I just looked up some information, I do have my concerns. If you're afraid, talk to me. I'm here for you. Talk to me. Pretty much all you can do. I wish I had a better answer for you.
When do you determine they need to stop driving? And how do you go about that?
Well, I always make the doctor the bad guy. If the doctor's willing to do that, it's just say, I really have concerns. They should not be driving. And a lot of people will listen to their doctor. Sometimes I have someone right now that their license is, should not be driving. Their license was taken away, but they still have the license. So that she still thinks she can drive. Well, the family's like, you're not driving. I'm not giving you the keys. I have had caregivers that have dismantled the vehicle so that they can't drive. And they've gone out there and put it together. So be careful if they're a mechanic. But it's one of the hardest things to give up because it's giving up your independence.
I've got a picky one back on page 3. Under common types of dementia, the second one is vascular dementia. Second most common, often followed by a stroke, implying that dementia comes first, then the stroke.
Either way. It can happen either way.
Okay.
I mean, everybody's different. Sometimes when a person has a stroke, then they find the dementia that could have been happening before that, but they didn't diagnose that. They didn't know. I mean, people can be living with dementia for years and no one knows about it because they're good at hiding things. Very good at hiding things. They think, oh, I'm just getting old. I hear that all the time. I'm just getting old. So, yeah. But a lot of times that when someone has a stroke, it's that vascular dementia that's going to be showing up.
How do you respond to a relative with dementia who asks about, like another dead relative? Oh, how's your, like my mom had passed away, so her sister, well, how's your mom doing? Or even her ex-husband. Oh, yeah, my ex, kind of doing fine, looking good, and like, they've been dead.
So, well, what happens if you tell them they're dead?
Yeah, I mean, we just, kind of nod, shake our head, and, we don't argue with them.
They're fine, they're at the grocery store, or they're doing, something that they like to do, those are those little white lies. Because it doesn't do any good to tell that loved one that their parent is dead. Because what they're gonna do is, what? Mom died? Oh my gosh. And they go through that grieving all over again. It doesn't do any good to do that. And a lot of times caregivers will say, oh geez, they've been dead for years. And they're like, what? Because they don't live in reality.
My brother just died. My mother's 102. She has dementia. Do we take her to the funeral? No.
That's up
We're
to you.
planning on it.
I mean, that's really up to you.
Just gotta get your call out.
Yeah,
Bring it back and see how
and I don't know your mother. So, I mean, it's really hard of what to say about that. I mean, she has closure.
I think so.
Yeah, that's my
We've
thought.
already brought her to his bedside. But she doesn't remember.
Right. And she might not remember going, but wouldn't you feel better knowing she went?
Yeah,
That's kind of
we're
what-
planning on taking her, but I
Yeah.
wanted to get your call.
Make sure that there's a family member or someone there that's by her with her, because if she needs to leave,
We will.
get her out. If she needs to leave, let her go. Don't expect her to do the whole thing, because that would be really hard on her. Yeah. Yeah,
Yeah, it's her fourth one.
whichever.
At what point do you, when you start looking to the point where you're looking at memory care units or memory care?
Now,
Well, okay, and what triggers that, other than the fact you're trying to do it ahead of time?
you want to have a name on a list, because you're not gonna get in.
Okay.
Pretty much. They're full. There's kind of like, all of a sudden there'll be an opening and then they'll fill it again. I mean, we've heard it. I mean, they're full all the time, depending on income of what you're looking at for income. I would tour them. Just tour a memory care unit. Anyone, all of them. Just say, I'd like to come for a tour. And you're gonna know by walking in if it's one that's right for your loved one. You're gonna know.
I was gonna try to bring that up somehow as well, because we have looked at some, and of course, right away, yeah, this one wouldn't be it, this one could be it. And I think with my dad, he's financially done well because they delayed gratification and saved and saved and saved. We've gone there and you see it's like $80,000 a year. It's very frightening for him to think that if that's the step, what if that's prolonged too? And then they're, because that's the first thing you want you to do is fill out financial paperwork.
Yeah.
So if you, I don't know how to say this really, if you haven't done anything, you don't have any money, then somehow you get care. But if you've waited and saved, and then it could be gone.
Unfortunately, yes, it could be gone. Memory care units are not cheap. They're not. I mean, she's in them all the time,
Yeah.
And I've worked in them. They're not, but they are. And that's why we have services available in the home for as long as possible. But you have to remember is that you have to be safe and your loved one has to be safe. That's what the main thing is. If there's a problem of them not being safe, if they're falling, if you're not being able to help them, if you're using a lift to help them, my goodness, that's too much. That's too much on that caregiver, too much on that person. So,
combative.
yeah,
If the behavior, not everybody has great behaviors, but if the behaviors start and they become very combative,
Right.
I can do that.
Yeah.
It's, people think that, they feel that guilt of having to let someone else care, but it's really becomes almost impossible.
Right.
And then, waking in the night, trying to get out of the house and stuff, so just.
Yeah, and that is that hard part is they call you, there's a spot open, but you're not at that point yet,
then you just say you're not at that point.
Yeah.
Well, yeah, you let it go, but it is, then you can.
I will say there are some local ones available now, and it's very, very fortunate. Sweet Living in Forest Lake is a brand new facility, so they have lots of openings both in their assisted living and their memory care.
Pine City too, Timber Pines is a new building. They just opened up their memory care unit. and they have openings. They only have a few people. They just opened up like last week. So, just tour, just go and tour.
Good Life in Hugo occasionally has an opening in memory care. And then another one over there that people just aren't aware of, or maybe it's new, very new, is Norbella. And another that's really cool, all catered around just memory care, is called Atlas Villas. I would go tour that in Centerville. It's really cool. This husband and wife developed it around her grandmother. When her grandmother had dementia and what she needed and what helped. And, so they have artificial sunsets and sundowns. They have birds chirping. Each little room looks like it has a porch around the front door, so they feel like they're in their house. It's pretty cool. Atlas Villas, Centerville.
I know Prayer Senior Cottage is another one that they've had some openings as well. That's an IC. Go ahead.
Couple questions. Have you followed any of the research on that says dementia is now called diabetic type 3?
I haven't heard it. I vaguely heard a little bit about that, but I haven't researched that at all.
Okay, and then, we're in this day and age where the 65 and up population is just growing and growing and growing. So you're gonna have a lot of peripheral amateur diagnosticians who are thinking, oh, they got dementia. What do you recommend to those people in terms of their honesty in their suspicions? If someone is having memory issues, to me it would be at that level to be upfront and honest and say, hey, I love you, I'm concerned about your memory. I don't know, are you having thoughts about that?
Well, if you have concerns about the memory, sometimes it's not memory loss because of dementia. Sometimes it could be medication, sometimes it could be an infection. A urinary tract infection is definitely one that someone that has a urinary tract infection, you're gonna think they have dementia right away, because that really acts in that same realm. So
either way.
Yeah, so I guess what I would recommend if you're concerned they have memory problems is getting to the doctor and rule out some things. The infection and different things that you might cause the memory loss. Rule out those things and then, horn in on, okay, this is what we've ruled out, you need to go to the next step.
And again, for those people, to say to them, hey, I'm concerned about your memory. Let's get these things ruled out. Let's see what's involved here, versus forming a subcommittee that has to decide.
I think just letting them know that don't even say the word dementia.
No.
Just to say, I'm concerned about your memory. Can we check to see if you don't have an infection or a urinary tract infection or something like that, and just go through the steps there. I guess I'm not sure what you're asking.
I just think we're going to be seeing a lot more of this as our population ages.
Yep.
Very, very quickly.
Definitely. We're going to have more caregivers.
Yeah.
Because they're not going to want to pay the cost to go in a memory care. Or they can't.
So being as proactive as possible, you're going to hopefully catch them sooner than later, rule out the other possibilities, and just be upfront and honest with them.
Right. And then just little things you can do in the home to make it easier for a person that lives with dementia. I know a lot of people that have notes that are all over the place, little sticky notes, just little reminders, and some people that live with dementia live alone. They do. Because they're able to adapt with their little things that they have in place. They have someone checking on them. They have someone doing their pillbox form.
Yeah, so that's a real good
Yeah,
one.
it
You
is.
wanna get them, if they're eligible for hospice, get that extra help in there, checking on them
Yep.
several times a week, you know.
We probably have time for one more question.
Okay. Who's been waiting?
I don't know what your question is.
Oh, my question was, do they do any kind of brain scan to verify?
Well, I have heard they do MRIs. They have done MRIs before, check the size of the brain. Because you can see if the size of the brain has shrunk, because that's what happens, is they shrink and they get older, you know. So they have done that, but a lot of people don't choose to do an MRI because that's extremely scary to put someone in there that has dementia. I don't like to have it done and I don't, you know, so, yeah. I mean, I think more and more as time goes on, there's gonna be a lot more testing, a lot more things done to diagnose. The one thing is doctors aren't really that great about diagnosing, which is not.
Well, we don't have good wellness visits anymore either.
Well, we'd like to give Colette a big thank you for starting.